Dual source CT, ready beyond tomorrow in cardiac imaging. Heart disease is a growing concern all over the world, and diagnosing and treating the condition poses unique challenges. To achieve optimal procedural planning, high-quality images are necessary, but this is not an easy task when you're working with anatomical structures that are always in motion. On top of that, you have to take into account the specific needs of each patient. Let's go into detail and look at some of the ways in which dual source CT can help solve these challenges in cardiac imaging today, tomorrow, and beyond. Most modern CT scanners can be used for routine cardiac imaging when the fine structures of coronary arteries need to be visualized. This is because, with the help of medication, you can slow down the heart to expand the diastolic phase. Under these conditions, you can acquire images without motion artifacts using single-source scanners. But the slow temporal resolution of such systems means that, regardless of how wide the detectors are, you run into problems once heart rates exceed 70 beats per minute. It's a completely different story with dual-source CT. When single-source scanners run out of speed because the available stationary period during the diastolic phase is simply too short, dual-source CT scanners can still keep up. Despite the significant temporal resolution benefits, it is possible for the diastolic phase to become challenging even for dual-source CT. This can happen when you're dealing with tachycardia or high heart rates in pediatric patients. Likewise, arrhythmia and congenital heart disease make things difficult as well. In all of these cases, the diastolic phase is too short or often unpredictable, resulting in motion artifacts that affect image quality. Single-source scanners offer two options for scanning under these conditions. The first one is to use multi-segmented modes that scan the anatomy several times starting at different positions and then combine the separate images. You end up with an increased radiation dose for just one poor quality image. The second option is to use software-based solutions to improve temporal resolution. The intent is to correct for a poorly measured scan, but there are significant limitations associated with this method. Of course, yet another option with single-source scanners is to accept that imaging at high or abnormal heart rates will generally be lower in quality, and just try to use them anyway. Single-source scanners struggle to provide optimal results under these conditions because of clear physical limitations. But with dual-source CT, you can simply turn to the systolic phase when you need to scan patients with tachycardia or arrhythmia. This phase remains stable and predictable for all patient groups. Dual-source CT scanners offer such high temporal resolutions that the image acquisition neatly fits into the systolic phase of the cardiac cycle. This enables you to achieve cardiac scans of exceptional quality in even the most challenging cases. Beyond coronary artery disease and congenital heart disease, another indication is moving increasingly into focus, namely structural heart disease. Minimally invasive procedures such as TAVI or TAVR require in-depth planning with the help of pre-operational images. Dual-source CT offers optimal support for these procedures. Thanks to the high-end image quality, you can measure anatomical features with great precision. New and highly advanced applications, such as mitral valve disease treatment, truly allow dual-source CT technology to unfold its full potential. To plan this kind of procedure, physicians need to be able to visualize the constantly moving cardiac anatomy using high image quality. This requires extremely fast temporal resolution. Single-source scanners are limited in this area and have no software to compensate for it. These limitations result in reduced image quality when you attempt to visualize constantly moving anatomy for individual patient conditions. Dual-source CT technology, however, is fast enough to visualize how the valves progress from an open to a closed state and back. These high-quality images of anatomical motion in action are exactly what you need to optimally plan mitral valve disease assessment and treatment. With Dual Source CT, you can scan the whole ECG in high quality, so the technology is perfect for routine cardiac imaging, for your challenging cases, and even for emerging cutting-edge applications. Furthermore, Dual Source CT technology allows you to address individual patient conditions, such as renal impairment, obesity, dose sensitivity, and other possible contraindications or additional clinical requirements, while also achieving high-quality results. Dual Source CT is a revolutionary technology. It features a range of acquisition modes to optimize image quality in every situation and for every patient. Discover how Dual Source CT can help you make the right diagnosis and ensure the right treatment outcomes for each individual indication. Dual Source CT, ready beyond tomorrow in cardiac imaging.